Hey, it's your old pal, Dr. Steve, and welcome to the SARS-CoV-2 COVID-19 updated situation report for April 26, 2020. This is the sixth in a weekly series. Previous episodes are available, and many of them have general information about the current pandemic that are not covered on a weekly basis, so check them out. Okay, let's get started with the current statistics that we're following. You can see the cases in the United States continue to level. We still have a lot of cases every day, but they're about the same number every day, so they're not increasing exponentially anymore. Similar phenomenon in Italy. And graphically, you can see that the United States numbers are showing still this linear increase rather than the exponential increase. And Italy is even showing some leveling off. Just starting to see that S-curve emerge. Here's the epidemic curve from last week, and you can compare that to this week. It looks pretty much the same, just this band is wider. Let's look at last week again. And here's this week. And these periodic dips and rises are due to reporting. The data sits on someone's desk over the weekend, and then a big glob of it gets output at the beginning of the week. At least that's my hypothesis. Looking at the United States in detail, here's the 20-day moving average. Here's a 5-day moving average. You can see that the 5-day moving average has dipped below the 20-day moving average, and the cases remained below the 20-day moving average for most of the week. And that is, in technical analysis terms, a sell signal. In other words, this is looking like a trend starting to trend downward. If this were a stock, we'd start thinking about selling it. At this point, I'd like to see a little more precipitous decline, but we'll take what we can get at this point. At least we're not seeing any increases right now. Looking at our Bollinger Band, and if you don't know what these are, go back 2 episodes, and there's an explanation of Bollinger Bands. The upper and lower bands are related to the standard deviation of the data that's coming in, and this line, the blue line, is a 20-day moving average. The red line are the number of cases. And again, we can see this narrowing of the bands, which means that the data is getting less choppy. What's coming in is more and more the same, therefore less of a standard deviation. And we're seeing definite leveling, and hopefully we're going to start to see a significant decline. The new cases bounced off the bottom band for the first time since this data was being collected. You look down here at around day 62, it looks like it almost bounces, but it didn't quite reach the bottom band. That's actually a good sign of a general downward trend. Not something you want to see in a stock, but absolutely something we want to see in an epidemic or a pandemic. Now, you may think, well, why are you using these statistical techniques used for stocks on new cases? Well, this looks like a stock chart to me, and I was very surprised that John Bollinger himself caught wind of what we were doing, and if you'll see his comments here, love your use of the Bollinger Bands on COVID-19 data. Give myself one of those.
Give yourself a bill.
All right, enough of that. I was very concerned when someone CC'd him my every other day posting of this chart that he would see it and either completely ignore it, which would have been fine, or worse, said, "What the hell are you doing? This is stupid." But instead, to get props from the man himself was actually pretty cool. So, all right. Compared to influenza, right now we are looking at 44,000 deaths in the United States compared to 24 to 62,000 for influenza. Of course, we're at the end of the influenza epidemic for this year, pretty much. Still see a few cases, and still very much at the beginning of the COVID-19 thing. At least we think so. So we'll see how these numbers pan out over time. As far as testing is concerned, you can see that we're up about 2 million tests this week. Lots and lots of tests being done in the United States. On a per capita basis, however, here we are about 16 tests per 1,000 people compared to Italy that's done 29 tests per 1,000 people. And once again, if we throw Iceland into the mix, wow. They are killing it. They've done over 10% of their population, so that's quite impressive. So we're hoping to get some good data from Iceland, at least regarding that population and their asymptomatic cases. So speaking of asymptomatic cases, there was a test done by University of Miami, and they're testing 1,400 random Floridians, and this is ongoing, so there'll be more numbers. There was a 4.4 to 7.9% of the population that they tested had been infected, with a 95% confidence interval, giving you about a 6% population that's been infected. If we could generalize this across the United States, that would mean that we really have almost 20 million cases in the United States, which is much, much higher than the known cases that we have. For every case, there would be 22 silent cases. Now, this would be encouraging if it were true, because it would mean that the death rate from this disease is 22 times less than we thought it was. However, I find it very hard to reconcile this with the data from the Diamond Princess that showed, a 17% penetrance. In other words, 17% of the people on that ship tested positive for the virus, but only 46% of those were asymptomatic. In other words, let's just say it was 50% for every one case that we knew about, there was one case that was asymptomatic, and that is testing a complete population, albeit a very small population of 4,000 people on that ship. But it's hard to reconcile that with this for every, 22 silent cases for every one case. So further testing will tell the tale on this. I am finding those two data sets difficult to reconcile, but I hope we'll know more in the next week or two. Interesting, Heather Height from Twitter tweeted to me an interesting finding that the French are studying nicotine as a possible treatment or preventative for COVID-19. Now, don't get too excited about this. This is a retrospective study. They looked at 480 patients who tested positive at one hospital. 350 were treated in the hospital. 4.4% were regular smokers who were treated in the hospital versus 5.3% that were not hospitalized. So there are fewer smokers in the group that were treated in the hospital. So presumably had more serious illness. And then I looked up the prevalence of smoking in France. It's like 32%. Now look, correlation is not causation. Nicotine may not be the true cofactor. There could be lots of ways that bias could creep into this, including poor data collection, which is a possibility. Because if they weren't looking for this, then this is just a fishing expedition for data, where you just take a bunch of data and later on you see if there's any correlation anywhere. Well, that's not useful for treatment or even making any proclamations, but it is useful for identifying things that are interesting to study in a prospective way. So we got to wait for controlled prospective data. How would you construct a study like this? Well, one way would be to take 1,000 people, all non-smokers, and you put nicotine patches on them. Now, this is not a good idea. Do not rush out and get nicotine patches, because there are adverse effects from nicotine, including vasoconstriction and increasing incidence of cardiovascular events and things like that. So I'm just hypothesizing, how would we look at this? And you would watch them over time and see if there's a decreased incidence in infection, given that the people have the same level of exposure in the group that had the nicotine in their system versus the group that did not. And to do this properly, you would have to blind it so that the patient doesn't know whether their patch has nicotine in it, and the person that puts it on them and checks on them doesn't know either, and you don't know till the end. So each patch would be coded, and then at the end of the study you take and you decode all of the patches and determine which ones were active and which ones weren't, and see if there's a statistically significant difference. They are constructing this study now, so let's wait to see what it shows, but it is very, very interesting, this phenomenon that they found, and it's worth looking into, but no more than that. A lot of controversy regarding ultraviolet light in the news this week, and ultraviolet light is known to be a disinfectant. High-energy photons are known to disrupt DNA and RNA on surfaces. This is where we're known to use this stuff, is to disinfect surfaces. So you'd think, well, why there would be no benefit to using this internally, would there? Well, there actually is a patent, and with no data behind it that I could find, but smarter people than I am are looking at using ultraviolet light as a germicidal light source within the body. This is an endotracheal tube that's inserted into the trachea, down into the lungs, and activation of this UVC light source causes radiation emission that kills undesired bacteria and presumably viruses at the same time. But this is at the tube cuff, where there is contact between the tube and the trachea, and there can be inspissation of mucus and trapping of bacterial particles. Lots more study is required to determine whether this would be a viable solution for anything, really. I think the original design was to decrease ventilator-associated pneumonia, but still interesting. Coronavirus drug update. Don't have a whole lot this week. There is a clinical trial tracker that you can go to. It's covid19-trials.com to look at the 649 different COVID-19 clinical trials that are out there. Number one drug being studied is hydroxychloroquine. So this will be very interesting, and this is a real-time tracker, and you may be able to get some results from this once they start being reported. Now, as far as reopening is concerned, some states are easing restrictions. Others are continuing their stay-at-home orders. Georgia reopened gyms, fitness centers, body art, cosmetic salons, restaurants, and theaters, but with social distancing and employee screening. Bars and nightclubs remain closed. Now, if you remember, the federal recommendations for entering phase 1 of easing restrictions is to have a 2-week decline in new cases and to not have overwhelmed hospital system and to be able to handle a surge should it happen. Now, here's Georgia. I'm not seeing that 2-week decline, so this will be a very interesting experiment to see if they're able to pull this off without a huge spike in cases. So we'll be following that. They started opening up around April 24th, so 2 to 3 weeks after that. If there's no huge spike, this will have been reasonably successful. Maybe a blueprint for the rest of the country, who are also not, in places that aren't showing a 2-week decline. If you look at Louisiana, they really have had a 2-week decline. If this is April 25th, then going back 14 days would be the 11th. That's right here. So there's some decline. It's not a huge decline, but it is a decline from where they were. If this is the line where they started, here's where they are now. So we shall see, my friends. Governors are banding together to form regional reopening plans. The new case data is kind of sensitive to testing rates. The more you test, the more new cases you find. So one of the proposals from the federal government was, okay, given that that's the case, if you have a decrease in percentage of positive tests compared to the total tests, then you may count that as well. New deaths per day may be a more reliable indicator, but that's also subject to bias and manipulation. There are some places that aren't wanting to report COVID deaths for whatever reason, and other places that may be over-reporting COVID deaths. So all of these things will get us in the ballpark, and that's really all we need for this. We don't need the exact precise number to be able to make these decisions as long as there isn't systematic bias. Look at the COVID SITREP from April 19th for more information on the federal reopening protocol. And you can go to this interactive 2020 states reopening list on CNN.com. The link is posted below. All right, until next week, stay healthy, isolate yourselves until your state tells you don't have to. Wash your hands and wear a cloth covering when social distancing is difficult. Check out our Twitter @WeirdMedicine and our podcast at riotcast.com/weirdmedicine or the SiriusXM show on Faction Talk Channel 103 on demand and Saturday nights at 8 p.m. Eastern and Sundays at 5 p.m. Eastern. We'll see you next week for the next Weird Medicine COVID-19 situation report. Take care, everybody.